should your patient have a meniscectomy, right? And this is, this is something I feel pretty strongly about because this research has been out for years. And the other piece is that surgeons in the United States, especially, they love meniscectomies, right? Like I said, it's a bit of a home run surgery. And we have a bit of research to show that, at least in the 2000s, the rate of meniscectomies were going up, 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 which is not necessarily a good thing, especially as we learn over the course of time that meniscectomies lead to more osteoarthritis over the course of time. So the British Journal of Sports Medicine 2017 clinical practice guidelines for arthroscopic surgery for degenerative meniscus tears strongly recommends against arthroscopy in nearly all patients with degenerative knee disease. Okay. And these are in folks with degenerative meniscus tears with or without accompanying arthritis. All right. So they say, do not get a meniscectomy. All right. And this is in patients that have mechanical symptoms, or without mechanical symptoms. Okay. Or with or without a sudden symptom onset. All right. So here's the thought process as a physical therapist, as a surgeon, right? I'm not a surgeon, so keep that in mind. Okay. So patients that have mechanical locking, the thought is, all right, the meniscus is stuck within the joint. We need to do surgery to get the meniscus to be freed up so the knee can regain its normal range of motion, right? And that kind of makes sense. But we do actually have some research to show that if someone has mechanical symptoms, they can actually get better or improve over the course of time, okay? And it's funny because having been a physical therapist for about a decade now, I have seen several patients like this, where they have an injury, seems like a meniscus injury, and over the course of time, they may have a whole lot of mechanical symptoms. So I've seen a few folks that have objective locking. So the knee gets stuck, let's say 15, 20 degrees shy of full knee extension, and they may hobble for a few days, right? Because they can't straighten out their knee, but eventually it kind of pops back into place, or something happens where the meniscus gets out of the way, they regain their function, and they actually make some improvement over the course of time. Okay. And this is pretty consistent with our medical literature because as a physical therapist, if someone comes to see me and they have a meniscus tear and they have mechanical symptoms, what I'm thinking is like, okay, maybe we need to get surgery because otherwise we're not going to be able to, eliminate some of these mechanical symptoms. Well, it turns out they can actually improve over the course of time. And I'm not saying that these folks shouldn't go in for a consult to a surgeon. I actually think that they should, right? And if there's a potential to get this repaired, they probably should. If they're young, it's acute, right? But keep in mind that mechanical symptoms can actually get better just like anything else. All right. So if you have a patient with a non-reparable tear, when should you consider meniscectomy? Right. Well, only if absolutely needed, if you've really failed a conservative approach. And keep in mind, if you look at some of the studies, if you compare physical therapy versus meniscectomy versus even a sham surgery, we have similar results. Okay. I would love to see some longer term data, 5, 10, 15, 20 years, 30 years down the line, to see which of these is going to be superior from an osteoarthritis standpoint. But generally speaking, all of these treatments are going to have similar outcomes, with the meniscectomies causing more arthritis over the course of time. Okay. And that's the reason why we don't like to have meniscectomy. So the ESCA Meniscus Consensus Project recommends waiting at least 3 months to undergo meniscectomy. Okay. I would also argue that you need to make sure that the patient is not progressing, right? And they've actually done a good job of rehabilitating their knee before they go on to get meniscectomy. Okay. With these folks, a conservative approach is best, consisting of physical therapy treatment and time. We know that this is helpful for meniscus pathology. So, what if your patient has a reparable meniscus tear? So, I think in this case, you can consider surgery to repair the meniscus. Potentially earlier is better, so less than 3 months. And if you delay surgery, that seems to be okay. Although we know that your re-tear rate is probably going to be a little bit higher if you wait too long. Okay. The other piece is that physical therapy is definitely an option. You'll have the same results as surgery in the short term, but there really is a lack of long-term studies to see the rates of osteoarthritis over the course of time. Okay. So now you have a little bit of knowledge of what to do with these chronic tears that are not reparable and also these acute tears that are reparable. So if you are loving what you are learning right now, I highly recommend you check out my fitness pain-free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away.